My mother had breast cancer, maternal aunt had a breast cancer. Is it possible I get breast cancer as well? To clear this, we have to understand something called mutations. Mutation is some kind of changes that happens in our body's cell that sometimes get carried from one generation to another. So there's particular mutation called BRCA1 and BRCA2 mutation that tends to get carried from one family member to the another. Previously, this mutation transmission was quite erratic, never occurred in subsequent generation. Of late, due to the lifestyle changes and how the things have changed, we tend to see this happening very frequently. That is, three generation continuously. The grandmother has breast cancer, the mother has breast cancer, daughter also has some kind of breast cancer or uterine cancer. This is happening quite often due to this mutation. Does it mean if my mother has breast cancer, I am also going to get? Am I written for that? Not necessarily. If by any chance you are carrying the mutation that is transmitted from your parent to you, there is a chance of you getting either a breast cancer or something of a ovarian or uterine origin. So, what exactly you have to do to be sure and be careful about it? If you are someone with a family history of cancer, recommendations suggest that you start early screening when compared to normal population. Normal population usually breast cancer screening at the age of 40 years, that is routine mammogram and self breast examination and clinical breast examination. If you have a family history, you should just start it little early, say about 30 years of age, and there should be routine mammography that should be happening. You do the self breast examination whenever it's possible, and whenever you get a master health checkup, get a clinical breast examination by a qualified physician. So this thing will help you be aware, and if at all you are getting some symptoms or sign, and if it's the early stage of disease, we can catch it very early. Know more about screening and diagnosis of breast cancer so that you can be more careful in the future.